Good morning, class. I just wanted to go over some things for this last week. I'm going to talk about the capstone as well, so you'll be able to be enlightened on both the capstone and the rest of our material. We this week 7 it talks about infidelity, marriage, and aging and sexuality, which some of you might find um, maybe a little disturbing, but hey, that is part of human nature. That is part of our own desires, our longings, is to be physically and intimately close with someone. So it's not shocking that sex still happens even as people age and change. Now, it may look a little different. Maybe the frequency might be different. But it is something that does still occur. And so, if you still take the aging class, I believe you're required to. It will talk about intimacy in regards to aging adults and what that looks like, and maybe even some issues that come up as a result of, still sexually transmitted infection is a thing. Maybe even not a concern of pregnancy, but there's a concern of other issues. And what that looks like as our bodies change, how that could affect intimacy, and our experience of it, and so that how that couples navigate that. But as we look at infidelity, within, and some of this might hit hard for some of you just based on your own experiences, or maybe being raised in households where infidelity happened. Infidelity creates major rifts in a relationship, and especially a marriage. Trust is the foundation of all relationships. And when I look at a marriage, trust is like the foundation, and everything else is built on that. And so if your foundation is messed up, more than likely your house is messed up. And so one thing I would like to say is, yes, no one has a right to cheat ever. Like, that's not a solution to dealing with an unhappy marriage. However, most marriages are not in a place where they're perfect, which leads to a person to cheat. Like, normally, if a relationship is having struggle, and or there's been a series of events that have led to maybe someone paying attention to somebody else and then them liking that attention, so on and so forth, it's kind of a slippery slope at that point. And so for those of you who are married and have never experienced this, that's why it's so important to stay in communication with your partner, really check in, to not be passive aggressive and be honest about feelings that you have. Because sometimes when these things happen and an affair comes out, whether it be a physical affair, an emotional affair, things of that nature, sometimes the other partner has no clue. And you're like, how could they have no clue? Well, they have no clue. Probably because feelings weren't being heard, or feelings it wasn't open to talk about, things of that nature. And as a result of that, there's major rift, and the lack of honesty causes poor decisions, so on and so forth. Or you look to other people to fill in the gaps where your spouse is not. So once an affair happens, often we pay a lot of attention to the perpetrator, to the person who committed the affair, and we're not paying attention to what led up to the affair. Now, it's not one person's fault or the other person's. I'm granted, an affair is never okay, but there is a dance that happens in a relationship, and something with the dance was not going well. And so that has to really be evaluated. Sometimes it's easier to leave than it is to stay. And it's really hard work to work through an affair, because you're rebuilding trust. Sometimes once the person tells, or it's discovery happens, that person who did the betrayal feels a little relieved, like, oh, it's off my chest. I don't have to hide this anymore. No more secrets, things of that nature. But then the other person's life is forever changed, and then has to deal with all the deceit, all the lies, all the things. And so it's just not easy. It's just not easy. And sometimes because that person's like, well, you say you forgive me, like move forward. And it's not like that. It doesn't work that way. So if this has ever been you, or people, it just takes time. Not that time is the only thing that heals it, but it takes hard work and the patience, a lot of patience of the person who chose to have the affair if they're going to choose to work on the relationship. And a lot of working through regaining that trust. Now, as a person who is, if the person who's been cheated on wants to know all these details, my suggestion is no details. Details do not help. Details stick in your brain and make it hard to reconnect with your partner. These memories come up, all these things. I had a client went through this. She had her husband write down everything that he ever said to her, all the places they had sex, what they did, what they didn't do, where they did. And it has now paralyzed her as they're now years out of the affair and seemingly like in a whole new type of relationship to some degree, working through that. But then it's like all these memories, because your memory sometimes is worse than what actually happened, right? But she's plagued by these memories or these ideas of what she thinks went on. And so that's why I encourage people, like, you don't need to know all the things, because knowing all the things makes it worse. Like, it's knowing isn't going to help you, really. I mean, knowing it happened is enough damage in itself, but knowing all the nitty-gritty does not help. So that is something I encourage you with clients. Like, how is this going to help? Like, it doesn't help to know all these intimate details with somebody else that then you're trying to sleep next to. It just doesn't help. So FYI, heads up, just letting you know, not helpful. Now, some people, this is a segue, when we look at, intimacy within marriage, and one person has, whether it be male or female, has sexual trauma. Now, not every person has ever told their partner. Sometimes people don't tell because they are too embarrassed to tell. And so sometimes until they're in an intimate relationship, do they really realize what's happened, or maybe a memory flashes back, or maybe a situation floods back, or maybe there's an uncomfortable touch or something like that, where even though your partner isn't doing anything to harm you, it just feels really uncomfortable due to experience. It's really important to communicate. And then as the person who's on the other side of that, who's trying to work with someone who's been abused, you need to be very patient, and you need to have good communication on what feels safe, what feels comfortable, so that everyone in the situation knows how to best handle the situation. Okay. We want our family, we want our loved ones to feel comfortable in all circumstances as best as we can. And so as we work to navigate intimacy and enjoying intimacy, we need to know what feels safe and what doesn't feel safe, even though you're not doing anything wrong. It just could be triggering. We use that term a lot, and some people are really thrown off by that word, but it is triggering. A touch, a sensation, a smell, a position, something sexually could be very triggering for someone else. And so to be mindful of that is really, really important. And so as clinicians, that's where it's good to ask hard questions, especially if people haven't spoken of their abuse with their partners. That's where you could encourage them. Maybe they should, and it would help with their sexual relationship, because honesty in this area is really important. Okay. So our last part of this class is your capstone. And what you'll be looking at is we're going to be looking at writing basically a treatment essay. So you will pick a sexual concern, some of the ones that we talked about, whether it be low sexual interest, ED, pain disorder, sexual identity, orientation, healing from sexual trauma. And then you're going to write a literature review. Okay. And then you're going to have a treatment plan, which you can use to, like, say how this person is going to work through these different issues, legal and ethical issues, faith integration, recovery-oriented principles, and identify 5 therapist techniques with the intervention. Each of these issues should have plenty of therapeutic techniques that you can find. They're all pretty common issues that happen quite often, so that shouldn't be an issue for you to be able to find that. And then you are going to submit it. The assignments due day 4. So remember, week 8 starts Monday, not this week, but Monday the next week. So it's day 4. So that's Monday, Tuesday, Wednesday, Thursday. So that's not this Thursday. It's a week from this Thursday. That is when the capstones are due. The capstones are due early because we have to grade them by that Monday. So it doesn't give us a lot of time. So anyways, that's something that's really important. Just want to make you aware of. You are going to need to turn it in on day 4 of week 8. Okay, this week, this video is for week 7. The following week is week 8. That's our capstone week. There will not be a live lecture that week due to you guys finishing up all your classes. Okay, so that's one less thing for you to do. I have thoroughly enjoyed teaching this class. I hope you've gained some insight and wisdom. Hopefully made you a little bit more comfortable with sexual ideas or topics. Sex is going to come up as you teach, or not as you teach, I'm sorry, as well, you kind of teach as you meet as a clinician. It is going to come up with you and clients, whether it be individually, with couples. It's going to come up. And so the more that you can feel at least comfortable with it, the better you will be in regards to how you talk about it. Being able to call body parts by their appropriate name, being able to hear someone talk about something that might be very unfamiliar for you, but that's okay. It doesn't have to be familiar. You just have to be able to be like very solemn and very, neutral and just hear them. You don't want to be judgmental. It's not our job to be judgy of people. It's our job to meet people where they're at. So I hope you found this course helpful. I've enjoyed teaching this class with you. And if you have any questions, whether it be now or the future, please don't hesitate to ask. We do have the course eval. You can please do that. It's 10 points extra credit. Fill it out. Just email me because I don't get a list the way I used to. So email me if you did the course evaluation and I will get you those points in the grade book. But if you ever need anything in the future, my email is the same. It's been the same for years. So it's thowdergy@calbaptist.edu. I hope you have a great week. Take care.